Over the last several years, my lab and others have identified a new source of mutation in breast cancer. So obviously it's been there for a long time, but we've recently appreciated it as a large contributor to mutagenesis in breast cancer. And the source of this mutation is called ApoBec3B. It's an enzyme that's normally an antiviral enzyme that is part of our overall innate immune response against infectious DNA-based viruses. And this enzyme, so the question of this study is how much does this enzyme contribute, or does this enzyme contribute to clinical outcomes in breast cancer? And can we model it in an animal xenograft system? And so the clinical question can also be rephrased as, is this enzyme contributing to essentially, so after an ER positive or after a breast cancer is diagnosed and sort of surgical resection, and if it's an ER positive breast cancer, does this associate with recurrent disease and resistance to tamoxifen therapy? So this was a retrospective study done in collaboration with a Dutch group, and we had a large cohort that was available for analysis. And what we were able to show by going back into the primary tumor specimens and asking how high or low this enzyme was expressed, we could then take those data and stratify them for outcome over time after essentially recurrent disease outcome. And with high levels of this enzyme, they had much poorer outcomes in terms of disease recurrence. So within a year, most of these patients had recurrent disease and resistance to tamoxifen as the sole therapy that was given at the time. And so those that had low levels of this particular enzyme did much better. The disease recurrence was much lower, and resistance to tamoxifen not as much of a problem.